Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you today with our Stay Healthy protocol. As you know, in these tough times, if you take care of your own immune system and eat right, stay lean, exercise, breathe fresh air, sleep, decrease your stress, you're going to be healthy and able to fight off nasty viruses. And plus, you're going to prevent heart disease and cancer, and you're just going to live a better life. So you need supplements. I mean, I wish you could eat, enough foods and fish and vegetables and all to keep yourself healthy, but nobody can do that. I haven't met one person that could really do that yet. So that's why um, supplements are my most important part of my food pyramid. If you come by my office, you'll see my food pyramid. Supplements are the most important thing in there. And I've totally changed my mind on this through the past 35 years of practice. But in any event, so I'm going to continue this series on what's important supplements you can take that are actually essential. And we're going to talk about fatty acids, omega-3s. Now remember, we were grown up and taught to fear fats. Really, it's just you should fear not taking fats. As a matter of fact, if the very most important part of my diet guidelines are increasing your good fats. And certainly the omega-3s are the best of all fats. In fact, omega-3s are my second most important supplement, right behind vitamin D, as you know that I really am huge on. But so let's talk about the omega-3 fats. They just have so many benefits. I'm going to try to get them all in here, but it's hard to list them. But we know it protects your heart, decreases your triglycerides, decreases your risk of sudden cardiac death, improves your brain, your joints, great for your eyes and skin. It's essential. So these omega-3s are essential fatty acids, meaning that your body can't make them. You have to have them. You have to have these essential fats or you'll die. So, and you get some of them, of course, in your foods, especially fish. Fish is your best source of the omega-3s. Some plants have one type of omega-3s called alpha linolenic acid, different than linoleic acid. But the important ones are EPA and DHA. Those are by far the most important ones. So when you think that, you think fish or krill. And when you're talking about ALA, you're talking about a plant source, and think flax seeds or walnuts. For people that will not eat fish or they're maybe vegan, so they won't think about eating fish, you're going to have to get it from plants. And it's harder to get it from plants, to be honest with you. But anyway, so the EPA and the DHA are the most important, and the DHA is by far the most important one. That's most of your brain fat is DHA. Very important for your retina, your eyes as well. Now, what about the omega-6s and omega-9s? It gets pretty complex, but the omega-3s and 6s are polyunsaturated fats. The 9s are the monounsaturated fat. So, in general, I'm going to try to make this simple. I'm kind of the doctor, the common sense doctor, so I'm going to try to make it simple. We could get into the amount of double bonds and polysaturated versus monounsaturated, etc. Just to make this simple. The omega-3s in general are the anti-inflammatory fats. The omega-6s, more inflammatory, although there's some of them that are anti-inflammatory. But to make it simple, we'll just say omega-3s are mostly anti-inflammatory. Omega-6s especially linoleic acid. That's one I measure when I do your Cleveland Heart Panel. One of the best things we do with the Cleveland Heart Panel is break down your fatty acids into the different types, and it just gives me a great idea, especially about that omega 6 to 3 ratio. And, you know, ideally it'd be 1 to 1, but I shoot for 4 to 1 or better. In other words, most people have more omega 6s in their body than omega 3s. And if you have a 4 to 1 ratio of 6s to 3s, you're doing pretty well. Even better is better, but that's very hard to achieve. So we'll kind of make it simple for you. But one thing I'll tell you about omega 3s is they're essential to make every cell wall in your body. And that's the structure of every cell in your body. Think hair and nails when you think cell walls, for sure. Now, there are some prescription omega 3s as well, like Lovesa, Vasipa, but they're real expensive unless your insurance is going to cover them. And, omega 3s are not all that expensive. I'll show you my favorite one at the end of this podcast. But anyway, so how much do you take? Anywhere from 1,000 milligrams to 4,000. I think 1,000 is too low. If you ever see a study that says omega 3s don't work, they're not using enough of it. So sometimes I'll push it hard, especially like for long hauler COVID. I use 4 grams, which is 4,000 milligrams. So I push the level, and it's not been emphasized enough how much of this you need. I take 3,000 milligrams myself, and mine's a combination of fish oil and krill and a few other things that they throw in there from Life Extension. Is very beneficial to you. But again, taking the Cleveland Heart Panel blood test is one of the best things I do because it actually shows me the breakdown. But there's so many benefits to the omega 3s. And I'll list just a few of them here that I've written down. One is it combats depression and anxiety. That's kind of surprising, but think brain, think omega 3s. Your brain is mostly fat and water, so you want the good fats in high number there. It improves your vision. Again, these are mostly DHA benefits. So if you had to pick one, the DHA is the most important one, but you need both. So it protects your retina and protects you against macular degeneration. As any optometrist will tell you, that if you take fish oil, you have a lot less of dry eyes. When I bumped my fish oil up, my eyes felt a lot better. And all of us old people get dry eyes. So it ensures healthy brain development. Think even in infants and fetuses. If you're a pregnant woman, you should supplement with omega 3s. Your baby's going to do a lot better. It'll decrease the chances of them having ADHD. It's very healthy for your heart, as you know. It decreases triglycerides. It's even a prescription medicine for that. It decreases your blood pressure, decreases your LDL, your quote, bad cholesterol. It decreases blood clotting, and it decreases inflammation. Again, which is a key to your health, is decreasing inflammation. It may be the reason it's so good for you in every way. So it helps your brain function better. It decreases metabolic syndrome. As you know, metabolic syndrome is central fat or obesity, high blood pressure, diabetes or prediabetes, and high triglycerides, which leads to heart disease and cancer and everything else. So it decreases inflammation and actually can help your pain. It certainly helps joint health for sure. It safeguards against autoimmune disease. Think rheumatoid arthritis, psoriasis, lupus, Hashimoto's thyroiditis. It decreases type 1 diabetes. As you know, I have 2 type 1 diabetes children, and maybe if we'd have taken more omega 3s during pregnancy, may have had a little better chance. But anyway, it helps with psychiatric disorders like bipolar disease and schizophrenia. And we've already talked about ADHD. It prevents mental decline like Alzheimer's disease. It definitely helps asthma and probably decreases your risk of cancer. So omega-3s are very, very important. It's my number 2 supplement that I go by. Um, Risk and side effects, well, depending on the quality of fish oil that you get, um, it makes a big difference. So I don't suggest going and buying your omega-3s at a big chain discount store. You don't know how long they've been sitting on the shelves. And pretty much if you cut into that pill and it's rancid, it may be worse than taking anything. So, the only drawback to omega-3s, it's a pretty big pill, but I don't have any problem swallowing 3 of those a day. I space them out. Who should not take it? Well, if you're on a blood thinner, you should be careful about it because it can increase your risk. Remember, it thins your blood, which is good, but if you're on a blood thinner, you have to really be careful about it. So there's been some, the other side effect you got to think about, sometimes it leaves you with a fishy taste in your mouth. The one I take really doesn't because it has krill in there. I like the Life Extension Super Omega 3 Plus because it has all kinds of good stuff. Olive oil extract, xanthan, which is great for your eyes and your brain. It does have fish oil in it, and it has krill in there. Now remember, krill are those tiny crustaceans, kind of like shrimp that live at the bottom of the ocean, and so they're not going to accumulate mercury. The big fish think mercury. Again, I eat a lot of salmon, and I want you to still eat a lot of fish that's really high in omega-3s. I believe if you could eat fish and vegetables, you're going to be probably pretty healthy. That's certainly what my diet focuses on. So if you have a bleeding disorder, be careful. Watch out for bad fish oil. And the pill is pretty large. You can even get a supplement. I think Barlean's makes it that comes in a liquid. So this has a pretty pleasant taste, believe it or not. It doesn't really taste like fish. So that's pretty good if you can't swallow that pill. But it's pretty slick and it goes down real easy. As you know, I use a lot of what's called pro-resolving mediators to treat long COVID. And basically what that is a high dose of EPA and DHA. As you know, you get a lot of brain fog and dizziness and all kinds of things with long COVID. So I think this really helps. That's one of the main things I'll put somebody on if they come to me with lingering effects of COVID. There's been some studies that show it may increase, fish oil may increase your risk of atrial fibrillation. So if you're at a high risk from that, be careful. I haven't really seen a lot in the literature about that. There was also one study I saw that does high dose increase your risk of prostate cancer. I've never really seen that, and I'm not really scared of that. There's so many benefits to this that I think it far outweighs the risk of getting those two things. But so fish oil, omega-3s are very beneficial to you. I do like the Life Extension Super Omega-3 Plus. That's the one that I take. And again, I just can't say enough about this supplement. I think everybody needs to take this supplement that's not at risk like we talked about. And those are very, very few people. So think about these things. Go out and check your Cleveland Heart Panel, and we'll look at your omega-6 to 3 ratio and kind of help guide you in this very important supplement. This is Dr. Tom Rogers at Performance Medicine. I hope you have a great week.